Health impact assessment, or HIA, is an approach where we combine three different types of numbers. We combine exposure information from populations, we combine that with exposure response functions, and numbers of incidence or prevalence of a disease in a population. For the health impact assessment tool that we are showing here, we applied this to two different examples. One based on exposure as measured in the case study sites, and another one based on exposure as modeled in the geospatial approach. We show in the assessment steps exactly how we came to our assessments. A very important part of this is deriving exposure response functions, which are based on existing epidemiological information from studies. We also show how these exposure response functions have to be combined if more than one study reports on these kind of outcomes. What we see in our calculations is that, especially for cases where we have a high prevalence of exposure and very high prevalence of an existing disease, this can translate to very high public health impact. So this means that it's really important to follow up with good epidemiological studies to improve information on the exposure response functions. Please check out the tools that we have provided here. They help in really trying to understand and calculate what the number of attributable cases would be.